Hello and welcome to Generational Wellbeing. I'm Dr. Lomfundi. Thank you for joining us today. I am honored to be here with Dr. Mukanga, who is a dentist in Texas, with us today. If this is your first time, I'm going to introduce myself. I'll tell you about her and then we'll get started. I am Dr. Lomfundi. I'm a pediatrician and founder of Generational Wellbeing. I help parents create sustainable, healthy habits for themselves and their children so that they can reverse the process of chronic disease. And thank you, Dr. Mukanga, for joining me today. Can you tell our audience who you are and what you do?
Well, thank you so much for having me, Dr. Friendly. Like you said, I'm Dr. Valerie Mukanga. I'm a general dentist, and I am the owner, founder of Healing Wings Dental. And so this is a place where we help people, maintain or regain their oral health so they can soar in life. And so that's pretty much what we do. We see people of every age, from kids to adults, and yeah, we provide procedures for them and just preventative care as well.
Awesome, awesome. I am really excited about having you here today because, I see a lot of kids, and according to the CDC, cavities is one of the most common, actually, it's said to be the most common chronic disease in kids,
Mm,
with
mm.
at least half of kids by the time they're 6 years old have cavities already. And in clinic, I see that all the time. So I'm excited to talk about this topic with you. And so, knowing that, keeping that in mind, how can you help parents create those oral or help take care of the kids where they don't end up with cavities?
So this is so befitting because a vast majority of our patients are kids. And so, yes, I have seen, and I agree with the CDC. I agree with you. It is definitely a very common problem. There's so many kids that have, cavities, and you'll be surprised because there's even babies who have, cavities due to so many things. So yes, it starts with parents because obviously kids don't feed themselves.
Right.
They have to depend on their parents as far as what they eat. And the reason why I'm talking about food is because the type of food that you eat really greatly would affect, your oral health. Cavities usually, are come about because of, the food that we eat, very sweet food. And it's not just, candies or cookies or juices from what people, think, but even things like milk, because you see that, there's many kids that suffer from baby bottle decay. And so it's just the fact that while they're just drinking their milk, even for the women who are breastfeeding, they can develop cavity from milk. Or even think about the fact that, especially in the US, there's sugar in everything. I mean, they put sugar in chicken. Okay. So like so it's everywhere, like in everything that you consume, there's sugar. But it's not just sugar, it's also starchy food. Like you'd see a lot of kids coming in with their chips and things like that. And it's just like kicked up on the kids' teeth, and that, conduce or lead to cavities. So parents, it would be very crucial for them to watch what they are feeding their kids, and even, it's very important to give them natural fruits, for example, like as kids love to snack a lot. But even with that, if you give them an orange, there's still sugar there. So very, very important to give them a lot of water. I remember when I was on vacation at one of my uncles, their kids knew not how to drink water. The only thing they drank was juice or soda. Like you give them water and they're like, they were not having it. Well, if you start with a kid from a young age, then that's what they're gonna know. So make sure you give them lots of water, make sure you monitor the type of food that you give them. I mean, I do understand that, and there are so many people or parents who come and they're complaining because they say, I don't give my kids all those things. I don't give them, those kind of sweet snacks and sorry, and things like that. But when they go to school, during the lunchtime, or they go to grandma and grandpa, and they can't quite control what's happening over there. But at least wherever you can control things, go ahead and do that because that would only minimize and they would, I'm assuming that the vast majority of their time will be spent at home with the parents. So that's something that they can do. Besides that, also making sure that they do help them brush their teeth at least twice a day, morning and night. Night is very, very important because most people know that they will brush their kids' teeth in the morning, obviously, but at night, it's very, very important to do it as well after they have finished eating, wait about maybe 30 minutes or so after, so that the acid in the food won't be, the effect won't be aggravated by the toothpaste and things, but like make sure that you do brush your teeth at night because at night we have a decreased salivary flow, so our saliva prevents or helps deter the addition of bacteria onto teeth where they would be eating the leftover food on our teeth and producing a byproduct which is acid that's going to be causing the cavity, which is just like areas where the acid would have affected the teeth and causing, these little holes and things that eventually grow into that. That's what a cavity is. So make sure that you do brush your children's teeth on a regular basis, at least twice a day. Um, Another thing is you also want to floss your children's teeth because the bristles of the toothbrush are too thick and they will not go between, in areas between the teeth. So even if, I mean, I know it's going to be hard to use actually, string, but you can even use those little flossers and that will go a long way. It's going to really help as far as, removing food debris and bacteria. When you're brushing your children's teeth, you want to make sure that you focus on the area between the gum and the teeth because that's where the food gets lodged. And so many people just brush like this, but they're not really addressing the area where, the problem actually lies. We also see so just don't I would advise parents to not be scared as well because there's a lot of parents who have anxiety, and with that, they will just transfer that anxiety onto kids. So you have kids who come and maybe they have never been to a dentist, to have experienced any traumatic experience, but they kind of like feed off of the fear that they can sense from the parents. So all of a sudden they scare themselves. So try to mask that if you can, or as much as you can. Don't be the reason why. Don't let your fear be the reason why you're not taking your children to the dentist. Try to overcome your fear for the sake of your children. Thank God I've seen many parents who said, when I was a kid, I had bad teeth because when I was a kid, my parents didn't take me to the dentist, and when I went to the dentist, all they did was just yank out teeth. But now I want to do better for my kids. So make sure that you do that you are that kind of parent who actually overcome their fear if you're fearful, to make sure that you ensure, a good basis for your children. I mean, in short, I know I spoke a lot, but those are some of
Yeah.
the things that I can kind of say as far as like what parents can do on their end to foster good oral health on their children and habits.
Yeah, well, yeah, you did say a lot and threw in a lot of nuggets there, but I will ask a question about with the parents and the fear, right?
Mhm.
If you're a parent now who has that fear and you've tried to brush your kids' teeth and they're fighting you all the time, and you just like, what advice would you give that parent on how to start modeling or helping the kid overcome that fear of you putting a toothbrush, or maybe one time you're fighting with your kid to brush the teeth and there was some trauma and the kid was like, there's no way you're not getting in my mouth anymore. How would you
Mhm.
advise that parent to help your kid?
Yeah, so I say this, like there are many parents who are mistaken because they think that just giving the toothbrush to the child, they'll be brushing their teeth right. But just think about it, if your children or your child does not have the manual dexterity to be able to tie their shoes, they probably can't brush their teeth right. So you need to help. And I know, I mean, there's many instances where kids are fighting you and it's very difficult. And so depending on the age, you would develop many different techniques. If they're young enough, like when kids are really young, say, a year, 6 months, because we start seeing them at 6 months. They're 6 months, they're a year, they're 2 years, and they're fighting you. You can do what we call a knee to knee approach. So we do a knee to knee exam where I would be sitting and I would be facing. You can do it maybe with the father if you're married, or with, a relative if you are, in your home. And so you would see face to face and knee to knee, where the parent or the person who is holding the child would be, we have the child facing them, and then they lay the child down, hold their hands while someone puts a finger in the back where there's no teeth so that they don't bite you. You put
Right.
your finger far enough and you're able to brush. And oftentimes, yes, they will cry, but if they cry, it means that their mouth is open. So you are able to actually access, their teeth and brush that way. You can do that. That helps a lot. That's how we conduct, our exam on little kids, when we do that and we brush their teeth. If they're old enough, you want to maybe like let them play with the toothbrush. Yes, you can have them, brush on their own or sing for them. Maybe you can, make them watch maybe like cartoons, positive cartoons, okay? Because there's so many of them that portray, dentists in such a bad light. But like positive ones where like, they see kids brushing their teeth and things like that, that would help. Kind of like when a child wants to be potty trained, you may be playing something where there's some kids, being potty trained. So yeah, if you show them some type of cartoon where they're watching kids brushing, that would help them. But you can also do that. Have them with you while you're brushing your teeth, and then also have them play with their own. And at the end, then you make sure that you do it afterwards. Yeah, or you can do it before and let them play with the toothbrush after. So I think those are things that can help as far as overcoming
Yeah.
that feistiness
Yeah.
of the children.
Right, absolutely, because there are things we have to do, and we can't allow our kids to do whatever they want to or not do what's right for them because
Correct.
um, they're going to fight us, right?
Yeah.
And I also like the modeling where they watch you to see how you're doing it because
Hmm.
I think one of the risk factors of kids having cavities is parents themselves having cavities. So
Hmm.
modeling is important where you're showing them how to do it and you're doing it to see you do it and they know it's something that is good for you, important enough where I'm doing it. And once you see me doing it, you're like, oh, it's not that scary anymore. So I can,
Correct.
myself and then yours and stuff like that. So that's good.
Right. Correct.
Another thing you did mention too was flossing. When is a good time or when can you tell is the right time to start flossing?
Okay. So anytime kids have teeth and you see, usually, whenever teeth erupt, it's usually two teeth that erupts, right? So it's not, I mean, sometimes it's one. So whenever you have teeth side by side, you want to floss between those teeth. So anytime they start, having teeth, you want to start doing that.
Okay,
Yes.
so because there's that misconception.
Sometimes, a lot of times kids have, especially the front teeth, oftentimes you have spaces between them, which is great because obviously, the baby teeth will be smaller than the adult one. But I mean, especially in the molar area, they usually don't have space. So make sure that you do floss those.
Okay.
Yeah.
And when is the best time to floss?
Well, I mean, I would say probably evening time. That's, kind of like they have eaten and everything, and before, because you want to do that at least once a day. There's no particular time, but I mean, I tend to do it in the evening. I think evening time would probably like be easier, but I think you can just gauge your child. I think evening, why? Because like in the morning maybe you're rushing to take the kids at school or they have to. So I think maybe evening time when things are winding down. I'll stick
Right.
with evening time. But there's no true like,
It's a, yeah,
responses for thou shalt do it at this and this time.
right. But important thing is flossing is good because of you have to get the things that get stuck in between the teeth and stuff, right?
Correct.
Right.
Correct.
Okay. And then, when we started talking, you talked about diet. We talked about the foods that can lead to cavities.
Mhm.
Why is juice and sodas so hard on the teeth? Why is it?
Yes, because the sugar. is what the bacteria would be feasting on. And after digesting it, it's going to be producing, the acid that's going to damage your enamel, your teeth surfaces. So besides that, juice also have acid, and acid can also go and cause erosions on your teeth and also sensitivity. So those are some of the reasons why, they're detrimental as far as what your oral health is concerned and causes a lot of damage on your teeth.
I see. Thank you.
Mhm,
And still continuing with the eating and oral health. Is
mhm.
there Tell me what your take is on snacking and oral health.
Yes. So snacking, it depends on what your children are snacking on. Are they snacking? I mean, because there are parents who are very health conscious as far as the kids are concerned, and you do see some people who come and they don't like candies. They eat, maybe like the celery or maybe carrots. That's fantastic because you want to eating food that are high in fiber is really good because it's going to help clean out also the surfaces of your teeth. So I would say it's almost inevitable to, to give your children snacks. But if you do or when you do it, make sure that, you reinforce, oral habits. You also want to limit things that are high in sugar, and that's what you can do. But it's almost inevitable to have them snack. Just make sure that they're brushing afterwards and also flossing. That's what I would say.
Okay.
Yeah.
All righty. And
You
then
can limit the amount of snacking as much as you can, but I don't know that you can completely, stop children from snacking on food. Yeah.
on food, yeah. Maybe limiting the time where we're not eating
Mhm.
constantly throughout the day, but we have
Correct.
some kind of schedule going where we have meal times and we have
Yeah,
snacking time as opposed to like at any given moment you're chewing on something.
exactly.
Yeah.
Exactly.
Okay. So we're talking about oral health, we're talking about cavities. What are the things that can happen if it's not taken care of early?
Okay. So if you don't take care of your teeth early, you can develop cavities. And having developed cavities, it's not something that's static where, oh, okay, so you have a cavity and it stays just the way it was. No, it continues to grow and it becomes bigger and bigger. So we have seen kids that have cavities where we can manage them by treat them by doing fillings, for example, but then when it continues to progress, it becomes big enough and too big to where you can't do a filling anymore. So now you're having to do a crown, perhaps, in order to ensure that you can keep those teeth because it's important to keep the kids' teeth. Many parents feel like the baby teeth, they're going to fall out anyway, but that's not really a very good mindset because what they fail to understand is that some of these teeth, the kids are going to keep for a long time. The front teeth will tend to fall out maybe around average 6 years old, but those back teeth, on average, they will be keeping them until they're like 12 or so. So you don't, if say your child is 7, you're not going to let that kid stay with a cavity for like 5 years.
Right.
It will continue to grow. They can lose teeth. They can lose teeth. They can develop infections as well, and the teeth, that are infected, the infection travels throughout the body. So, you want to think about that. The same infection that's at your teeth can end up in your blood, can end up in so many different areas. But also, you can end up having pain, pain. Your child may not be able to go to school because now, the pain is so big. And when the tooth is has been damaged enough, it can be damaged to a point where the tooth has to be removed. So when you have teeth, the back teeth will be holding space for the adult teeth coming up that will be pushing them up. So if you lose teeth, yes, we can. I mean, many people don't come back for what is called a space maintainer, where we put like a device that would keep that area open so that the tooth, when it erupts, the adult tooth, you find its space. So sometimes, your bite collapses, and then, you have created additional issue on the child Not only when you lose teeth, you're not able to eat as well. So, that affects your body in that sense. But also, later on in life, you might end up having braces, which you could have kept those fundings for something else, that it's not cheap to have braces. So there's all those things, that can happen when you don't take care of these cavities early.
Awesome, awesome. Thank you, Dr. Makanga, for joining us today. Are there any other tips you want to give for us before we end this session?
Yeah, so I want to really just reinforce importance of making sure you take care of your children's teeth. Create that time to do that. And in addition to what we said, you can also give them, when they're old enough, give them toothpaste that does have fluoride, because fluoride will strengthen your teeth. And I know there's so many controversies about that, but fluoride will help you keep your teeth stronger. So you can give them even maybe a mouthwash that has fluoride. Don't give them too much. Yeah, so those are kind of like tips that I would say. Make sure you brush at least twice a day, you floss at least once a day. Make sure that if they're too young, you do it for them. Don't just watch them, or don't just, not reinforce them. There's so many parents who come and say, yeah, when you tell them, they have to, you heard what the doctor said, you have to brush your teeth. And I'm looking like, okay, but he's too young, mom. You have to help them. You have to help them. So be involved in that. Yes, that's what I could say.
Absolutely, absolutely. And thank you. Very important with the fluoride. And yes, there's a lot of controversy, but fluoride, it's something that we need in our toothpaste. Now that you brought that up, one last question. One last question. Toothpaste, right? There's a lot of different toothpaste targeting kids and adults and stuff. What do you recommend for a parent who is looking for toothpaste? Should they buy the one that's targeted for kids? Because I do, or I have seen some that have sugar in it,
Mhm,
especially for the kids. Are there any
mhm.
specifications when you start recommending? As far as we're starting early, we want to make sure there's fluoride in there. When do we start using toothpaste? What should we look for when we're looking for toothpaste for our kids and our infants?
So you can start using toothpaste from whenever they have teeth. However, when they're young, too young, and they're not able to, and they swallow everything, you want to make sure that you give them, they're not able to spit out the toothpaste. You want to give them training toothpaste if you're going to be using toothpaste. So you would go to the aisle where they sell, baby products, and then you'll be able to find training toothpaste. They also have toothpaste, and even on Amazon, you do have toothpaste that does not have fluoride for the people who are anti-fluoride. So that's an option. However, once the patient or the child is able to spit out, then you can give them toothpaste that does have fluoride. I would say kind of look on the label on the toothpaste. If it has ADA, which is the American Dental Association, a seal on it, you're pretty much safe. I would say that. So yeah, just make sure that if they cannot spit out, try to give them training toothpaste. After that, that's okay, but you don't have to fill up the toothpaste on the toothbrush. Just pea size, that's good enough. That's a good amount, so that you make sure you don't ingest too much either, because when you have too much fluoride on your teeth, it can start, either give the child when they swallow, because they will swallow some. It can give the child stomach ache, or also it can also change the color of the teeth and make them switch the colors of the teeth. So you don't want to put too much toothpaste on your toothbrush either. So that's what I can say about toothpaste.
Awesome. Thank you, Doug. So for anyone who's listening and they're like, I like her, I want to come visit her, where can they find you?
Yeah, so we are located in Dallas Fort Worth area in Arlington, to be precise. We are Healing Wings Dental, and our address is 4101 West Greenwich Boulevard, suite number 317. And you can find us online as well, on social media, on Facebook or on Instagram, on LinkedIn, on YouTube. When you type Healing Wings Dental, you will reach us. And our website is healingwingsdental.com, and you can secure an appointment or request an appointment. That phone number is 972-213-0202. That's how you can reach us.
Awesome, awesome. Thank you again for your time. And I'm looking forward to maybe having second phase of this conversation soon.
I would love to come back.
Thank you.
Thank you so much for having me again.
Thank you.